day, good morning, good evening, good afternoon, depending on where you're joining us in the world. Thank you so much for joining in to hear a little bit about our featured employer that we'll be discussing today, MercyOne. My name is Tracy Toothaker. I'm the Director of Recruiting here at Worldwide HealthStaff Solutions, and I'm joined by Mindy.
Hi, everyone. I'm Mindy, and I am the Associate Director of Recruiting Operations with Worldwide HealthStaff.
So today we're so excited to talk a little bit about MercyOne. So we'll go ahead and get right into it. Also, just as we move along, please feel free to drop any questions you may have for us in the chat, and also let us know where you're joining us from. We'd love to see where you are in the world. So requirements for these opportunities with MercyOne, there are two things that are required to interview with MercyOne. One is that you must have your NCLEX, have passed your NCLEX. And then number two is that you must have at least 2 years of current bedside nursing experience in the specialty that we are hiring for MercyOne. So we will talk a little bit more about the specifics of the various units in a little bit. And then also, next, we'll talk a little bit about just kind of all of the opportunities within Worldwide HealthStaff Solutions. So just specifically for these roles, but then also too for all of the opportunities that we support. These are direct hire EB3 visa opportunities. So these are full-time direct hire roles. You will be a direct employee of the hospital. And we also, through the EB3 process, we will assist with your immigration. And what is included in that is that your immediate family members will be included into your visa processing at no extra cost. There is no English exam required for processing. And then we also reimburse for visa screen and medical exams once you have accepted an offer and are going through the immigration phase. And then, of course, when you arrive, we provide free airfare to the U.S. for the nurse, and then at least 30 days of housing as you transition here to the United States. So just kind of an overview of some of the pieces included into the opportunities with Worldwide. So now we'll talk about MercyOne, which is very exciting. We are partnering with them for several opportunities that we will discuss. And MercyOne's headquartered in West Des Moines, Iowa. They are a nonprofit system of Catholic hospitals, clinics, and healthcare facilities, and specifically in the states of Iowa, Nebraska, and then surrounding communities. MercyOne's dedicated to delivering personalized healthcare and improving the health of people in the communities that they serve. And they're backed public policies that promote better health, better care, and lower costs. So that's an overview of MercyOne. And next, we will discuss a little bit more about them at a high level. So some facts about MercyOne is that they are one of the largest healthcare systems in Iowa and beyond. This includes more than 3,200 licensed hospital beds, and they're committed to providing community benefits, charity care, health education, and programs to manage chronic long-term diseases. Again, they operate in Iowa, Nebraska, and surrounding communities, being headquartered in Des Moines. And then their mission, we, MercyOne, serve together in the spirit of the gospel as a compassionate and transforming healing presence within our communities. Their vision as a hospital is as a mission-driven, innovative health organization. We will become the national leader in improving the health of our communities and each person we serve. We will be your most trusted health partner for life. And then the core values that sort of harness that mission and vision are reverence, commitment to those experiencing poverty, safety, justice, stewardship, and integrity. So some really great core values, mission, vision, and overview that MercyOne stands behind. Okay, so some fun 2024 numbers to share. MercyOne had over 4 million patient visits in their various clinical environments. They have 230 care locations. over 22,000 colleagues within the health system, and then 200 million plus community benefits. So they've provided benefits into the community through education, health services, charity care, as well as unreimbursed Medicaid costs. So some really great mission work that they're doing. Next, we'll talk about the various MercyOne opportunities, and I'll hand it over to Mindy.
Thank you. So, as Tracy talked about, we will be recruiting a little bit. We have a huge event coming up in August for MercyOne, and we have, I'll talk a little bit more later on about what positions we currently have available for them. But here are some additional benefits. If you choose to interview and you're extended an offer, if you chose to sign, these are some opportunities that would come with that offer. They do require, again, 2 years of current bedside experience in the unit that you are interviewing for. So if you are interviewing for an OR position, you need to be currently working in OR and have those 2 years of experience. You also must have a BSN in order to be placed on a schedule and interview with MercyOne. So that's very important. Some benefits that they are offering, they will offer you a $10,000 sign-on bonus, and then either $5,000 housing allowance or 30 days temporary housing. That would be your choice after you sign the offer letter, which you would prefer to go in terms of relocation. And then with any worldwide opportunity, you will also receive visa screen, medical reimbursement, and then the plane ticket for the RN. And so some current openings that we are recruiting and sourcing for right now. These are the different, the separate regions in Iowa for MercyOne that we are recruiting for. So in Waterloo, Cedar Falls, Old Wayne, these are all different locations in Iowa that we're currently recruiting for. They are looking for acute care nurses, ED or ICU nurses. For their Des Moines and West Des Moines location, we are in super need of med-surg RNs. For Dubuque, we are looking for cardiovascular and senior care nurses. Clinton, we have a lot of med-surg openings available. And for their North region, Mason City, we're looking for critical care, cardiac step down, labor and delivery, behavioral health or psych nurses, OR, med-surg, cardiac cath lab, pediatrics, and post-surgical. So those are the openings that we currently have available. If you are interested, if you're currently working in any of these, please reach out to your recruiter. If you are not currently working with a recruiter, please email our recruiting inbox, and that information will be at the end of the presentation. So here are some a high-level view of the benefits that the company MercyOne offers to all of their full-time employees. So with an employment offer with MercyOne, you would be offered basic life and accidental death insurance, medical, dental, and vision insurance, short-term and long-term disability, flexible spending accounts, paid time off, vacation, sick times, and holidays, 401k or 403b retirement savings plans. Each location with MercyOne has different benefit packages that all include these basic levels of benefits, but they do vary depending on the location. So to get exact information per location, please reach out to your recruiter and they will have that information for you. And so here's a few informational quick stats about Iowa. Iowa is really central U.S. They have a lower unemployment rate than the majority of the nation. The average commute time is 18 minutes, which Tracy and I in this big city that we live in Charlotte, North Carolina, 18 minutes is really great. It takes us about 30 minutes to get anywhere we need to in Charlotte. So 18 minutes is a great time. They do have a annual rainfall of average of 36 inches. That means you're probably going to get every season in Iowa. So winter, spring, summer, fall, you're going to experience all of them. They have beautiful parks, green spaces. So if you're somebody who loves the outdoors, Iowa is going to be for you. It's a super low cost of living for Iowa compared to bigger cities and states within the U.S. Iowa is going to have a really great low cost of living. So if you have a family and you want to make the most of your dollar, Iowa is the place to be. Next slide, please. So a little bit more about the cost of living. Here's a really quick cost of living comparison. So we have taken the time to compare typical utility and other necessity costs for Dubuque, which is one of the locations in Iowa that we're hiring for, and then against Des Moines and West Des Moines, and then also against San Francisco, just so that you can see a little bit more in depth about the differences in costs of living per area. And so for Dubuque, you can see a monthly total, an average would be around a little less than $8,000 a month to live comfortably here with 2 adults and 2 children. And West Des Moines and Des Moines are about the same at $8,000 a month for all of these typical necessities that one would need for 2 adults and 2 children. And then see how huge the increase is when you get into an area, a bigger city area like San Francisco. That's almost a $10,000 jump in difference. And so this is a really great indicator of the cost of living in this specific area. And if you chose to interview and sign an offer with MercyOne. And again, we talked about an event coming up in August. We do have a huge event happening at the beginning of August, first week of August. Tracy and myself will both be in person in Des Moines, West Des Moines, and Dubuque and Mason City to help with this huge hiring event. If you are currently in works with a recruiter, please reach out to them and let them know that you're super interested in getting on a schedule. If you are not currently working with a recruiter or you have not heard from your recruiter in a little while, you can reapply at the healthstaff.org link here and let them know that you are interested in getting back in contact with your recruiter and would like to know more about this opportunity. We are happy and excited to talk with you about it.
Thanks so much, Mindy. Yeah, so very exciting opportunities. One other thing to mention, we will actually be having another webinar live from the recruiting event in Iowa at MercyOne the week of August 4th. I believe it's going to be on August 5th. So please tune into that too, because we'd love to talk about the event and the facility itself while we're there. So that's exciting. Okay, so I think there's a couple of things in the chat. And of course, if you have other questions, please feel free to add them in. I know I see the positions that are available. I know we ended up going over that in a separate slide, but if you would like a list of what's available or would like more information on those beyond what you've learned today, please feel free to reach out to your recruiter if you're working with one. And then, of course, if you have not yet applied and are interested, please apply directly to our website. We will put that link in the chat so that you are able to apply through there. These opportunities do require the NCLEX, so definitely encourage you to get prepared for that. And we can provide some resources to you that help prepare you. We aren't able to, beyond that, do any kind of NCLEX testing or prepping besides just allowing, the access to some of the resources that we know of to help prepare as you take it. And then I think, let's see, I skipped one. Oh, for premium processing, I see a question here. So we are absolutely able to recapture a priority date once you're current. So once you become current, we can discuss the steps of processing and recapturing. So again, encourage you to reach out to your recruiter about those steps or apply directly if you have not already done so. Oh, great. I see someone from South Africa has joined us. That's great. Amazing. So MercyOne does have a partner credit union. It's named, I believe, Mercy Credit Union is the name of that. So yes. And then as far as the sign-on bonus goes, and the housing allowance, that will be upon arrival and the start of assignment. And these amounts are taxed. So yes. And then medical technologists. Yes, we absolutely have. We have those types of opportunities. So would love to talk to you about what that looks like. You know, obviously for the purposes of the discussion today, these are EB3RN opportunities, and that is absolutely the abundance of the type of opportunity that we see. But happy to talk to you about future medical technologist roles that we plan to support. So yes, please feel free to apply directly. We would love to discuss those with you. And then if you choose the housing allowance instead of the 30-day accommodation, we will work with you in whatever capacity to identify housing, whether that be through the allowance or the actual accommodation partnered with the hospital. So our relocation team will help you whichever step you choose to take. Okay. All right. One other thing to mention, we would love for you to interact with us on our various social media platforms. So please connect with us on Facebook, YouTube. We have the links here, and we'll put those in the chat as well of how to engage with us. We have webinars almost weekly, definitely weekly, that I think all of you would find very informative and relevant. So please follow us there. You can see all of the different topics and content that we have hosted historically. And obviously, as we continue to host webinars in the future. And again, reminder, we will have a live from MercyOne webinar on August 5th. So would love for you to join us for that as well. And then additionally, if you have a nurse or a colleague that you would like to refer to us, you are able to earn up to $250 per referral. And so we'll put the link in the chat for our referral link as well, but that's also displayed here on the screen. Perfect. Okay. This is a good question. If I get a position, will there be opportunities to transfer to other MercyOne locations? Your assignment is determined, by your hiring leader, but there are absolutely opportunities once you've been placed to transfer to different units or locations. We have seen several nurses do that, just depending on, the communication and engagement with their immediate hiring leader. So that's an option for sure. Yeah, good question. Amazing. Okay. Any other questions out there for us? These were some good ones. Thank you. Okay. Well, thank you everyone so much for tuning in. We look forward to seeing you again in a couple of weeks when we are live for MercyOne. And thank you so much. We look forward to seeing you again soon.